13 medications with potential liver damage. Did you know that all the medications and supplements you take must pass through your liver? Liver damage, known as drug-induced hepatitis, can occur immediately or up to 90 days after ingestion of these substances. In the United States, over 2,000 cases of acute liver failure occur annually, with half of them caused by medications or supplements. This video will highlight 13 medications that can particularly harm the liver and discuss the early signs of liver damage caused by medications. The 13th one will shock you. 1. Isoniazid is an antibiotic commonly used in the treatment of tuberculosis, TB. It is a key component of the standard TB drug regimen. While isoniazid is generally effective in treating TB, it is important to be aware of potential side effects, including liver-related concerns, hepatotoxicity. Isoniazid has been known to cause hepatotoxicity, which refers to liver damage. This adverse reaction is relatively uncommon, but it can occur. Hepatotoxicity is more likely to happen in certain populations, including individuals over the age of 35, those with pre-existing liver conditions, and people who consume alcohol regularly. 2. Statins. Statins are a class of medications primarily prescribed to lower cholesterol levels in the blood. They are commonly used for the prevention of cardiovascular diseases. Statins work by inhibiting an enzyme involved in the production of cholesterol in the liver. By reducing cholesterol levels, they aim to prevent the formation of plaques in blood vessels. Statins, including atorvastatin, simvastatin, and others, can, in rare cases, lead to liver abnormalities. 3. Tamoxifen. Tamoxifen is a medication used primarily in the treatment of breast cancer, both for the treatment of the disease and as a preventive measure in individuals at high risk of developing breast cancer. While tamoxifen is generally well tolerated, it can, in rare cases, cause liver-related side effects. Elevated liver enzymes and more severe conditions such as fatty liver disease and hepatitis have been reported. For Diclofenac, presents a noteworthy concern among anti-inflammatories, such as ibuprofen and naproxen, which carry a potential risk of liver damage, although this is a rare occurrence. Specifically, Diclofenac stands out as having the highest potential for causing liver injuries. The adverse effects of Diclofenac can become apparent weeks or even months after initiating its use. It is crucial to recognize that Diclofenac can impact not only the kidneys but also the liver. 5. Amoxicillin. Despite its effectiveness, there is a significant concern associated with this medication, as it has been linked to numerous cases of acute liver injury. Acute liver injury is a serious condition characterized by sudden damage to the liver, which can lead to severe consequences if not promptly identified and treated. Therefore, when prescribing or using amoxicillin with clavulanate, it is imperative to acknowledge this potential risk. Healthcare professionals should closely monitor patients for signs of liver injury, particularly if the medication is used for extended periods or in high doses. Patients should be informed to seek immediate medical attention if they experience symptoms such as jaundice, yellowing of the skin or eyes, dark urine, extreme fatigue, nausea, vomiting, or abdominal pain, which may indicate liver problems. 6. Amiodarone. Also known as Ancaron, a medication frequently prescribed by cardiologists to manage cardiac arrhythmias. It stands out as one of the most effective treatments, often leading to significant improvements in arrhythmia and even demonstrating efficacy in 24-hour Holter records. However, it's essential to recognize that amiodarone carries a high risk of side effects. This medication can adversely affect various organs, including the thyroid, lungs, skin, and notably, the liver. Due to its wide range of potential side effects, its usage has become more restricted compared to the past, typically reserved for specific cases where its benefits outweigh the risks. While amiodarone generally does not cause acute liver injury, its harmful effects on the liver may take several weeks to manifest. 7. Allopurinol is often prescribed for individuals with elevated uric acid levels or those suffering from gout, particularly when dietary modifications alone are insufficient to manage the condition. Allopurinol effectively reduces uric acid levels in the body and helps prevent gout attacks. However, it's crucial to acknowledge that allopurinol can have adverse effects on the liver. Liver injuries associated with its use can occur rapidly, sometimes within days or weeks of initiating treatment. Therefore, patients starting allopurinol therapy should undergo careful monitoring for any signs of liver damage. Regular medical follow-up is vital to promptly identify and address any emerging issues. Patients should also promptly report any unusual symptoms experienced during allopurinol treatment to their healthcare provider. Despite these risks, allopurinol remains a valuable therapeutic option for many patients with gout or high uric acid levels. 8 anticonvulsants. Among these, phenytoin, marketed as Hydental, and valproic acid, sold as Depakote, have been identified as potential causes of liver damage. Hydental may initiate liver injury shortly after commencement of usage, while the effects of Depakote may become apparent between 1 to 6 weeks after treatment initiation, underscoring the importance of regular liver enzyme monitoring. Additionally, although less common, carbamazepine and lamotrigine are also associated with liver injuries. 9 Methotrexate is widely utilized in treating conditions like rheumatoid arthritis, psoriatic arthritis, and certain cancers. However, vigilant monitoring of liver enzymes is crucial due to its propensity to cause liver injury, which can range from mild to severe and, if left undetected, may result in significant liver damage. Physicians typically conduct routine liver enzyme tests in patients receiving methotrexate to promptly identify signs of liver damage, facilitating adjustments in medication or treatment strategies to mitigate complications. Adherence to medical guidelines regarding methotrexate dosage and frequency is imperative to minimize the risk of adverse effects, including hepatic complications. In some instances, healthcare providers may explore alternative therapeutic options to mitigate the risk. 10 antifungals, particularly fluconazole and itraconazole. These antifungals, highly effective in treating candidiasis and nail mycosis, have been linked to hepatotoxicity in susceptible individuals. Hence, if you are utilizing these medications to address mycosis, it is crucial to be vigilant about the earlier mentioned signs of hepatotoxicity. 11 Methyldopa. A commonly prescribed medication for managing high blood pressure. Although known for its overall safety, especially being the preferred choice for pregnant women with hypertension, methyldopa has been associated with potential liver damage. For individuals already afflicted with liver diseases such as fibrosis or cirrhosis, the use of methyldopa is not recommended. It's noteworthy that adverse effects on the liver may become evident up to 12 weeks after initiating treatment with methyldopa. Therefore, patients prescribed this medication should undergo regular monitoring to promptly detect any indications of liver impairment. This precautionary measure is vital to prevent exacerbation and ensure that hypertension treatment does not inflict additional harm to the liver's health. Individuals with a history of liver diseases should engage in discussions with their healthcare providers to explore safer alternatives. 12 Antipsychotics, including risperidone and quetiapine, marketed as Seroquel. These antipsychotic medications, used in the treatment of psychoses and refractory depression, those resistant to conventional treatment, possess the potential to induce liver damage, primarily through a process called drug-induced cholestasis. Drug-induced cholestasis occurs when there is an interruption or reduction in the flow of bile from the liver. Bile is crucial for fat digestion and aids in eliminating certain waste from the body. When medications like risperidone and quetiapine disrupt this process, bile accumulation in the liver can potentially lead to hepatic damage. Patients undergoing treatment with these medications should undergo careful monitoring for signs of liver issues. 13 Paracetamol. It is widely recognized as a primary contributor to drug-induced liver failure. Typically, liver injury is not associated with the standard dosage but rather with excessive doses. Unfortunately, due to its popularity, some individuals misuse the medication by taking more than the recommended amount, risking an overdose. It's essential to underscore that following the recommended doses of paracetamol is safe. Doctors commonly prescribe paracetamol to infants for treating fever or pain without complications. However, surpassing the recommended dose poses a danger. Over a third of liver failure cases attributed to medications are linked to paracetamol. An overdose of paracetamol can lead to acute liver failure, carrying a high mortality rate and often necessitating a liver transplant if the organ cannot regenerate itself. Unlike the kidneys, which can be temporarily reversed through hemodialysis in some cases, a compromised liver often requires transplantation. The list of medications carrying hepatotoxic potential is extensive and encompasses antiretrovirals, vitamins like niacin, various antibiotics, supplements, and even teas, which were discussed in another video. The liver, being a vital organ, plays a crucial role in the overall functioning of the body. Did you find the video interesting? If so, please consider sharing it to spread awareness and subscribe to the channel for future updates. Until the next video, thank you for watching.